Hopefully you're doing all right.
I'm okay.
Okay. So I we did quite a few different things, and during my exam, I did note a couple different things that I wanted to talk to you about. We did do that UA, and it did seem like it may be contaminated. It didn't.
Oh no.
It's not a big deal. We can always run another one. We mostly wanted to just rule out any sort of infection because some of your symptoms could be associated with that. So we could run another one. If you do have another UTI, I would want to send you over to urology just because 3 or more in a year is a lot for any one person.
Is that from maybe not changing my pads enough, or?
It's hard to say. Something I did notice when we were in our exam was that I did note what we call a cystocele. And what that is, it's just basically your bladder and your vagina have like almost come together. There is a repair that can be done, but it is a surgical repair. But that's, not something we need to necessarily address today. What the biggest thing I wanted to talk to you about is what you are experiencing. It sounds a lot like what we would call stress incontinence. So basically, anytime there's stress on your body, whether it's a cough or you're standing up, you have a little bit of urination. You're incontinent from the stress. So, the big things with that are that the symptoms you're having are this leakage and it just isn't controlled at all. So the big things we want to do is we want to make sure that your pelvic floor is strong. And so when we have vaginal births like you did, so you had 4 of them.
Yes, Harold and I had 4 boys.
So your pelvic floor has trauma from that, and then it can weaken over time as we age and as we have less estrogen in our body as well. But there are things we can do right away for it. So there's a couple different things we've talked about. But what the biggest thing I want you to focus on is we're going to focus on the medication, non-surgical interventions right now, and we'll kind of talk through those. So you had already voiced that you would like to lose some weight. This will really help because it'll bring down the pressure that is on your bladder by bringing down the weight on your body.
When I was pregnant with my last one, I did have some leakage issues then too.
Mm-hmm. Absolutely. Other thing would be to make sure you're not suffering any constipation. Having more stool in your colon, there's not much room in that pelvis. So we want to make sure that you're going to be taking a stool softener that could help with you have more regular bowel movements, and that also would bring down that pressure that is on your bladder.
I do have I am constipated, but when I go, I have to go. It's a race.
Yeah. The other thing will be, like I mentioned before, which would be the pelvic muscle exercises. We can absolutely review how to do those and how you can isolate those muscles today. And then also I would like you to see one of our physical therapists. They specialize in that pelvic floor muscle training, and they can really help you strengthen those muscles.
So it's not just like doing some sit-ups or...
Nope, it's a little different, and you actually don't want to use your abdomen. You want to focus it in the pelvis area.
Okay.
So, and you actually focus on that. And then, there's a few different things also we can do, which is we can have you, whenever you feel like you're about to cough or you're about to have, you're going to stand up, I would want you to consciously contract your pelvic floor so that you don't have that sudden loss of urine.
Oh, okay.
So, like I say, there are other interventions that we can do, medications, surgery, but these are all the lifestyle modifications that we can do. I also would want you to start taking in more water and less caffeine, just because, and I know a lot of people love their caffeine, but caffeine is an irritant to the bladder, and it perpetuates on this cycle of needing to go and irritating the bladder.
Oh, so would I have to give up my diet soda?
It does have caffeine in it, so I would like you to try to start drinking some more water if possible.
Okay.
And so those are the big changes I wanted to talk about with you today. I would also review any pathophysiology or anatomy with the patient if that is needed, and then we could also discuss the cystocele operation if needed as well.